Hi, this is Sherry Kimball, and I am a doctoral student in the Family Nurse Practitioner program at Colorado Mesa University. And this is a GNOME project for school that is goals, needs, objectives, measurement, and evaluation. And I am going to talk to you today about individualized music and Alzheimer's disease. Alzheimer's disease is an irreversible, progressive brain disease that affects as many as 5.4 million Americans and 44 million people worldwide. It slowly destroys brain function, leading to cognitive decline, which could be memory loss, language difficulty, or poor brain functions. Behavioral and psychiatric disorders, which might be depression, delusions, agitation, and declines in functional status, which is their ability to engage in activities of daily living and self-care. Alzheimer's disease and related dementias are associated with many complex needs, and this creates challenging skills needed to be for the caretakers or caregivers. Complex problems such as aggressive behaviors, restlessness, wandering, eating problems, incontinence, delusions, hallucinations, or mobility problems might be issues that need to be dealt with. Many people with Alzheimer's or dementias do retain some of their positive personality traits and personal attributes, and that's where individualized music can build on their strengths. In 2011, the National Alzheimer's Project Act was signed into law to establish the National Alzheimer's Project, which helps to coordinate research and services for the prevention, diagnosis, care, and treatment of Alzheimer's disease. The national plan is guided by three principles you can see here on the screen, and we're going to be discussing those or incorporating them in this project. So the national plan encompasses a vision of eliminating the burden of Alzheimer's disease and related dementias through these 5 different goals. And you can see I've highlighted the middle 3. That's will be the emphasis of this project: to enhance care quality and efficiency, to support people with Alzheimer's disease and their families and caregivers, and to enhance public awareness and engagement. So my goal is to provide the staff at the Garden Plaza of Aurora with the knowledge of individualized music as a care option for all residents, but especially those with Alzheimer's disease. It's my hope that at least one person might be sparked by this non-pharmacological care approach that can help to ease caregiving burden while providing residents the ability to be calm, happy, cognitively improved, even temporarily, with diminished inappropriate behavioral problems, increased positive interactions, while providing greater quality of life through the incorporation of individualized music. And again, these follow the national plan principles and goals. So dementia is characterized by cognitive impairment with increased stress as a result. With increased stress, there's agitation and negative behavioral outbursts that often are the result. The presence of agitation, depression, and/or behavioral and psychological symptoms have been reported in as high as 90% of those with Alzheimer's disease and related dementias. Agitation and depression negatively impacts their quality of life by interfering with care and social interactions. Treatment of the behavioral symptoms of dementia is often one of the most challenging aspects of treating patients with Alzheimer's disease or other dementias. The management of chronically confused and or agitated patients traditionally included chemical and or physical restraints. However, these approaches may cause adverse physical and psychological effects way beyond that of the original agitation. Non-pharmacological treatment of behavioral symptoms is universally recommended as an initial approach. Limitations and concerns have led to research on alternative interventions for managing agitation. One such theory driven intervention, which has been clinically and empirically validated, is individualized music. So, the objectives of this presentation are at the completion of the presentation, the learner will be able to discuss the benefits for the residents with Alzheimer's disease of incorporation of an individualized music program for care management. You will be able to verbalize an understanding of the established music and memory program that I'm going to discuss and be able to identify resources that could help to begin an individualized music program for your residents. The methods that I will use are included in a Plan, Do, Study, Act model, and you can see on here the model to the right. And so I've summarized the information about individualized music and the effect on Alzheimer's patients, positive changes that can be seen through the use of music, and strategies for implementation of individualized music program. The doing step is to educate the staff on the above stated information through Take a Break and Learning mini learning sessions, which would include PowerPoint presentation, a video clip, and then a resource list that's provided. You can then go out as a staff member and implement individualized music program with adjustments as you see fit, and then evaluate that on an ongoing basis to continue to educate staff, residents, and their families. So music has power, especially for individuals with Alzheimer's disease and related dementias, even in the very late stages. Music can shift mood, manage stress-induced agitation, and stimulate positive interactions, facilitate cognitive functioning, and coordinate motor movements. Music stimulates the brain. This happens because rhythmic and often repetitive responses require little to no cognitive or mental processing. They're influenced by the motor center of the brain that responds directly to auditory rhythmic cues. So a person's ability to engage in music remains intact late into a disease process because again, these activities do not mandate cognitive functioning for success. Many people associate music with important events and a wide array of emotions. The connection to music can be so strong that hearing a tune long after the occurrence evokes a memory. A melody that's soothing for one person may remind another of the loss of a loved one, and that could be tragically sad. So it's important to observe a patient's reaction to any particular music and then discontinue it if it evokes distress, such as agitation, facial grimacing, or increased muscle tension. As dementia progresses, there's a loss of language and communication skills. Music provides verbal and nonverbal expression and so increases social activity and cognitive stimulation through reminiscence and self-identity. Like I said before, music also helps people to stimulate memories and reminisce about those memories. Many life events involve music: religious gatherings, social events, concerts, graduations, weddings, or even funerals. Music is a therapy that's safer than medications, and some authors even say that it has the potential to reduce the need for antipsychotic medications. Active music is when a person plays an instrument, sings, or composes music. Passive music involvement or receptive involvement is listening and then appreciating through senses. So individualized music programs incorporate passive music, which they're listening to, but also can involve some active music if they sing to it or they dance. There actually has even been a tool developed specific for music assessment in dementia patients. Many authors have found that there's a positive effect for individualized music or music in general on Alzheimer's patients. Obviously, mild to moderate dementia has a better effect than moderate to severe, but all dementias have a positive effect. The Music in Memory program is a nonprofit organization that was started by Dan Cowan, and he founded this prior to 2012. In 2012, there was a documentary called Alive Inside: A Story of Music in Memory. And there's a video clip if you want to stop this in the program and clip on that. Hopefully, the link will work. Of one of the residents that it um, significantly affected was Henry. And over 1 million people have viewed this video. It actually was the impetus for me to do this project. I was just amazed at the response. Wisconsin has also developed as a state the Memory and Music program and has come up with funding to certify care facility centers in this very specific program. There's 2 links here, and I originally recorded them. If you're seeing this presentation with me, you'll see the videos incorporated, but in order to upload it for people to watch on their own or to upload it into my class unit, the pulling the video in was too big of a stream to download. So the first video you see right here, where's my arrow, is a 2-minute trailer, and then this is a 6-minute trailer. So if you have time, I would watch the longer one, but you have the option to watch a shorter version of this. These are just a trailer as part of that music and memory program, and you'll just be amazed at the responses. So you might be thinking, I can't do this. Lots of barriers are put up. One of those might be cost. My suggestion would be to get donations, to find someone that's good at writing grants. There's a lot of money out there if you are able to take the time and write to get some money. Volunteers, people that love music or love older people or have a special interest in dementia, oftentimes are more than happy to get excited about a project like this. You might be saying that there's limited staff. Again, really focus on volunteers. Key in on a volunteer and then they can get other people excited. Look at incorporating music therapy into all different kinds of therapy that's happening. Working with colleges or high schools or any kind of music program where people want to do some kind of a volunteer program. You may say that there's difficulty in gathering music selections. I'm going to show you here a link in a minute to an easy guidelines for incorporating, finding out from either the resident or from family members if they liked music, and then also what kinds of music. So the guidelines right here, I put both of these on reference lists, the music and memory ones and also individualized music quick reference. This is the one that I would look up for sure that guides you through. You can work with professional music therapists. There are people out there that actually are trained in this, but also anybody can do this. It's as simple as gathering the information. I'm going to give you a sheet that you can follow. Pulling that music onto an iPod so that they can have headphones and listen. That way it's not distracting anyone else. They can listen in their own space. This link right here, I actually was going to go to it, but it pulls too much in to be able to download it. This link, if you'll click on it, gives you this individualized music quick reference. It's about 5 pages. It gives you a page for residents, a page for family members, and then walks you kind of through the basics. You'll need iPods and then the ability to load music. If you have teenagers or young kids around, they're very helpful. Can show you how easy it is to do. Gathering the music, like I said. I love this quote that was part of the Music and Memory program. Despite the enormous sums of money spent on mood and behavior altering medications that are often not particularly effective, Nothing compares to these iPods when it comes to improving quality of life. So, in summary, individualized music provides improvement in disruptive behaviors, reduction in anxiety, reduction in depression, improved cognitive functioning, and that's temporarily. This isn't a long term solution, but it was amazing in the video. These people that weren't talking and it didn't seem like there maybe was much going on in their brain all of a sudden started reminiscing and talking about their life. And this leads to enhanced confidence. These are helpful links. I did a special so that you could stop the video and click on these. The Alzheimer's Foundation has good information on music. This was a special site about music therapy for dementia. These are very specific evidence-based guidelines. It's a longer paper. The Individualized Music Quick Reference Guide is a real easy read-through, and that's the one that has the list that you would use maybe on your admission assessment, or people are just wanting to go individually to figure out about music. This is the music memory and music reference, and then also the guide for care professionals, so it gives you a little more specific information. So in evaluation, I would like you to answer these questions. I will have sheets if you're meeting with me personally to fill out, or verbally give me responses. If you're watching it through a link that I sent you, please go to my email and send me within just a day or two of watching this. If you can right away send me your answers to these questions, I would very much appreciate that. And these are the references. I will go through them since it's a video so that you could see it. You could stop on these if you want to click on any of the hyperlinks or write the information down. I would encourage you to Google music and memory online to look for the full hour-long video that incorporates the moments with Henry. If you have an hour to watch the video, you'll just be amazed. It goes through multiple patients, residents in various Alzheimer's facilities, and the changes that they come about just from listening to individualized music. Thank you again for listening to my presentation, and I hope you enjoyed it and you will go out and do something with music.